You're listening to the Zen Cop Podcast.
Guys, welcome back. Mac Rollins, Zen Cop here. This is the Zen Cop Podcast, Season 2, Episode 12, and I'm super excited to finally have Dr. Erica Fung on the show. We've been trying to put this together for a while now. It's just been an issue of timing and schedules, and she's a very busy woman. I'm so happy that she has made time to be on the show. Erica is she's a supervising licensed clinical psychologist for correctional health out of LA County. She's a wealth of knowledge. Originally from Hong Kong, she came to the United States to pursue educational aspirations surrounding psychology. She's an avid golfer and just a really neat person to talk to. I've enjoyed our conversations offline, and I'm really excited about this episode. So, guys, let me introduce Dr. Erica Fung. Erica, for those who are not familiar and would like a peek into the biography, if you will, of Erica, give us an intro, please. Thank you again, and welcome to the show.
Well, thank you for having me. Hi, my name is Erica. I am a licensed clinical psychologist who's currently working in a correctional health setting. So I'm a supervising psychologist. I'm originally from Hong Kong. I came here for school, interested in psychology, and pursued further education to obtain a doctorate degree. And after I passed my licensing exam, I joined correctional health. And then I've been working there for 6 years.
Awesome. And again, thank you so much for being here. I know we've been trying to get this episode up for a while. You and I both have kind of opposite schedules, but I appreciate you taking the time to talk to me. So one of the things that I really find fascinating as of late, especially, is just sort of the psychology behind a lot of what we see internally and externally in the law enforcement community, and also the correctional side of the house, which I've had a couple of people on the show who have really opened my eyes to the internal workings of that system. The psychology that can be very prevalent in law enforcement, especially today. And if we look back on, years ago, even decades ago, everything has changed a lot in terms of, the psychology behind a lot of what we do, to include, even things like interviewing, which is becoming a different tactic. We're seeing a lot of science-based stuff for a lot of the interview and interrogation techniques, and even just the psychology of what I would consider to be the kind of the populace of what's in the correctional system. And even in my own travels and findings, one of the more consistent things that I've seen, despite it being sort of a topic that most cops would sort of scoff at, is the background and the trauma that is pretty consistent with, I would say, almost the majority of the population that's currently in custody. You do a lot of work inside the jail. Can you tell us a little bit about what you do and kind of the things you've seen so far?
Sure. So when I first joined correctional health, I work in a program that providing treatments for the inmates. So the inmates are my patients. So I see them could be weekly, or some of them are not severely mentally ill. I can see them monthly. So basically give them mental health support while they're incarcerated. And I would say probably a year ago, I got promoted, and then I moved to a different department. It's called IRC, Inmate Reception Center. And I mainly provide triage interviews. So basically, they just got arrested, and then they got dropped off by either police officers or the sheriff department. And then nurses do the screening, and then if they refer them for mental health, then I'll screen them to see if they actually need mental health services. And then I house them according to the level of care that they need. And I actually enjoy, I would say this is more assessment-based instead of treatment-based. And to me, I'm more of an assessment person. I actually like my current department than my previous one.
Nice. And for the audience who doesn't know, when we're talking about treatment versus assessment, that's sort of like the intake process, right? They're getting evaluated to determine what they need.
Yes. So let me use this metaphor. I use it all the time. So hypothetically, imagine that you are in an emergency room. Okay. So the department that I'm working at is like an emergency room at the hospital. So you come in, you have some crisis or trauma, and then you come see a doctor at the emergency room. The doctor will see you. Oh, okay, this is what your issue. Okay, let me divert you to certain treatment room. So like cardiology, blood work, or like other like other department. So where I worked before would be one of those treatment rooms, like cardiology or like oncology or something like that. So right now I'm working like an emergency room.
Okay. And then the
Yeah.
triage process just sort of determines where they go and essentially what they need.
Mhm.
That's a mental health is, I think, a very big topic right now, but it's got so many subsections beneath it that, the majority of people, I think, assume that and this is, I mean, I think most cops assume that the mental health aspect, and sometimes it is the result of drug psychosis or something that has happened previously in this person's life. But
Mhm.
um, I would imagine that the majority of the people you see would qualify for or qualify under, I guess, some type of trauma or mental health related incident that may have, caused issues for them previously, and now they're dealing with that crisis in the immediate, I guess, if that makes sense.
Yes, and definitely trauma is a big issue. It's actually very interesting. I would say 2 days ago, there was a deputy who asked me, what do you think it's the main reason, for all these inmates who could be a frequent flyer that's coming in and getting released and coming in again? And then I told him, if you ask different people will give you different, answers. But if you ask me, after I graduated from grad school, I actually worked with children. So I was a child psychologist for 5 years. And I mainly work with foster kids. So who got abandoned, abused, parents might use drugs and all that. And then they got detained and then they placed in foster care or group home. So I would see them as my client. So if you ask me because of this background, I would highly say that parenting, and then also trauma, which include if mom is pregnant and then mom is using drugs, so the fetus already get traumatized while mom is pregnant. So yes, also I see a lot of them who actually grew up in the foster care system constantly has to adjust to a different foster home and doesn't have a stable living environment, who might not have a mentor or a foster mom or foster parents who guide them on making appropriate and wise choices.
Yeah, I would absolutely agree. I think that there's a lot to be said about stability in the home. And
Mm.
the majority of I would, say our frequent flyers, I was on our homeless outreach team for a few years, and I started to sort of catalog the data that would come in, and a lot of them were adopted. A lot of them were fatherless families, so there was no father figure in the home. And a lot of them it was usually some type of substance abuse with parents, whether it was alcohol or drugs or both. And over time and working in the same area, you sort of see these kids grow up, and the majority of them would be just like their parents. Very rarely would you see someone sort of divert and do something different. That was kind of a rarity. Um, but I agree that there's such a huge gap where we see almost no structure, no real you know when it comes to the actual parenting process. It's almost like it's non-existent. And I could say that for the people who I see successful and that have, even you, I read a little bit about your background. It seemed like you had a very uh I don't want to say strict, but it was a little bit, your parents, I think, intentionally. There was an article that I read about you where your parents would never really answer your questions. They would kind of leave it open ended. And I really
Oh,
liked that. I thought that was neat. You talked about your dad. There was something at a restaurant where your dad,
yes.
this guy had a question about the bill, and you asked the question, but he basically said no, like you'll figure it out on your own someday, which I thought was really interesting.
Yes. So my parents never really answered my questions, but definitely, guide me in certain way. So if I have to, again, I love to use metaphor. If you think of like how to fly a kite, you let it fly, right? You let it fly. But here and there, if it goes to a way that you don't want them, you just pull that string, right?
Hmm.
So my parents
Yeah,
just like that. They're just pulling the string whenever, they think I'm going to a wrong way. So, mhm.
I like that. So in a sense, I would say that there's a lot of people out there whose parents, when it came to flying the kite, there was no redirection, no
Definitely.
correction, and usually, that's kind of where we see there was almost no control. And control is a word that I like to use a lot when it comes to the criminality stuff and just society overall. But if we were to go down the rabbit hole, we both live in California, so we also know how lackadaisical the criminal system or criminal justice system is right now. And
Mhm.
just like a child, if I were to tell my son, hey, don't do that, and he keeps doing it, then there's a punishment. He, gets something taken away, or he gets to go to his room, or would grounded, whatever it is. But if
Mhm.
I don't keep that punishment intact, then he's going to learn that over time I'm just bluffing and nothing will change. And so if we were to, kind of comparatively look at the two side by side, I would say that 100% the criminal justice system is a big boy, big girl, you know,
Mhm.
timeout or whatever it is. Um, but if there's no follow through, there's no control or correction, then these adults that are now these sort of big children are going to just assume that they're going to get away with it over and over again. And oddly enough, it is a lot like having children. And I could understand from your perspective that you sort of have to give them some type of
Mhm.
direction. And is that something that you um you know see pretty consistently in terms of having to sort of lay out foundation, or are the majority of them, I guess, sort of lacking that positive figure in their life?
Well, I actually do see that. Yes, that's true. And usually, they would tell me. Well, I don't know how we would talk about this, but then sometimes it just popped up during my assessment, and I'm talking about now. Like when I'm seeing them as a triage, they just come in. Um, this is a pattern that I see. Usually, people who are willing to tell me that they are coming from a foster care system, they are usually younger, and when younger, I would say in their 20s or early 20s. And then when they're coming in, they would come in with like a little attitude as if like no, I'm not scared of you. Like they will show me a little like smart ass comment. They make a little smart ass comment, and then and in my head, I was like, something. You're telling me something. Okay, hold on. Let me continue to observe and see what I can pull out from you, right? So okay, and then very soon they will tell me, oh yeah, I grew up in a system. No one cares about me. Da 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 da. And then when I hear that, it hurts because I used to work with them. And then at that moment, I don't know, like I would pull out my big sister hat. I'll put my hat on and I'll be like, okay, number one, this place is too young for you. I mean, you're too young for this. You shouldn't come here. And then a lot of them at that moment they already have kids. And then I said, do you want to be a role model for your kid? And he was like, of course I do, because I don't have one. Then I was like, okay, even better. I like that. I like that goal. So how do you stop this pattern? Because I do see a pattern in your kid coming back. You want your kid to follow your pathway. I sort of wanting to motivate them in the way that how they want to raise their kid. Do they want to raise their kid that they wanted to be raised, or they want to change it up? You know, and of course, some of them will involve drug use and all that. I was like, so you use drugs and you have kids. Do you want your kids to see you doing that? Or do you want your kids to see you high? And then, I would use that as a motivation. And usually that works.
Yeah, and you and I both know, but for the people who don't, it's one
Mhm.
thing to talk about it, it's another thing to do it. And
Definitely.
I feel like the addiction aspect, especially with what we're dealing with in terms of fentanyl and opioids in general, it's not, for the people who just say, oh well, just stop doing it. That's not how that works. It's not a,
Hmm.
you just can't stop. It's a
Yeah.
process that usually involves a lot of medical treatment, and could potentially be fatal if you don't do it properly. uh,
Yes.
which is
Usually
interesting because when
alcohol.
you're, yeah,
Usually
alcohol as well,
alcohol.
yeah.
Yeah, benzo. Those two are fatal.
Yeah. And then the sort of that concept of, while they're in pocket, right? They're talking to you. Again, it's a controlled environment, and we all know that the likelihood of them committing to that if they were to get released is slim to none. And that's unfortunate, because I think you and I both understand how hard it is and competitive it is to get into housing, to get into a facility, to even do a tea house or something. That the strike while the iron's hot theory is 100% true with someone who's going through crisis and
Mhm.
they're battling addiction. And like you said, it's one of those things where you put on your big sister or big brother hat, and you sort of have to tell them, hey, this is the way it is. Like, these are your options. You're going to die if you don't change, and it's your choice to make. In a county like LA, numbers wise, are you guys dealing with a pretty high volume of people who come in? I mean, I know that it's a high volume, but I would rephrase the question with, in that populace, what is the, I guess, not necessarily a number, but percentage of people who actually want to commit to a program or commit to some type of change?
I actually came across a lot of them, and then especially in my previous department that I work for, the treatment room, a lot of them would tell me, "Oh yeah, can you please help me to get into a program? Can you please refer me?" And I always tell them, "Okay, there are two options. One, you go to the court, you tell the judge that you want to make a change, and the judge may do a court order program, but you have to stick to it." And usually, I will teach them three rules. Number one, take your medications when you're at the program. Number two, you cannot touch any drugs or alcohol. Number three, you have to stay until they actually discharge you. You cannot leave without permission. So I said, if you can commit to all these three rules, then you can go to a program. But also want to mention that yes, it's easier than to say than done, because of the substance use. There's cravings. There's like, oh, I try, but then the craving gets to me, that kind of thing. That's so true. And from the mental health perspective, the what is that word called? Um, like being sober and going back to use drugs, that is actually part of the treatment process. Like
A
we wouldn't
relapse.
expect, yeah, relapse. Yes, right. Yeah, I forgot the word. So you basically like relapse has to happen in order for you to recover. So
Hmm,
but how often does that happen versus like it happens the next day or like after you get into the program, or you can stretch to have that relapse happen like later on. How
yeah,
long the relapse, that would matters.
for sure. And yeah, I've seen my brother. Well, he's sober now, but he was an alcoholic for years, and yeah, it comes in waves. But the interesting part is that the drug component is just one piece, and I think that the trauma or whatever it is that happened will reactivate that, or potentially cause the relapse, or the whole reason to why they're addicted to something to begin with. Very rarely do you have someone with addiction and no, mental health issues or anything like that. It's usually one and the same. They're usually using a substance because of something that happened to them or stuff
Mhm.
like that. So
They
yeah,
want to
that's a
They want to
go ahead.
cope their trauma with using drugs. They want to
Yes,
forget about the trauma. They want to numb themselves. So they thought that using drugs can actually help them to forget, whatever the trauma it is. Actually, that's not right. And drugs definitely, we all know that it's not a healthy coping skills. I think there are two things that can be done. Number one, like you need to develop some healthy coping skills, like coping as if like, oh, if I'm anxious, if I got triggered by the trauma, maybe I can do some deep breathing to calm myself down, or maybe I can go on a run, to calm myself down to get the adrenaline going, right? So, or another thing is like to go to mental health treatment. So, one part of the trauma treatment is a very long process. This is another metaphor I like to use. I don't like to do trauma treatment while they are incarcerated. Like this is what happened to me. Like a lot of patients ask me, can you help me? I'm traumatized. And then I would tell them, unfortunately not now, because you're not going to be here for a long time. Like unless you're going to be here for like years, 2 years, then sure, we can start that. Because if let's say you injure your arm, like you have a big cut, you go to the emergency room, you show the doctor, hey, I have this big wound on my cut. Can you treat me? The doctor cut it up open and then bleeding. You're bleeding heavily. And the doctor was like, looked at it. Oh, okay. You can go home. And then they just quickly sew you up without doing any treatment in there. Then what happened with the wound? You'll continue to be bleeding, you get infected and all that, right? Same thing
Yeah.
with trauma work. If let's say I open up your wound, you become very, very vulnerable talking about this trauma, and then me not doing anything to treat your trauma, or I don't have time to treat your trauma, then eventually you went home. Then the treatment stopped. Then that wouldn't be nice for me to do that. So I highly recommend that my patient who wants to or who's motivated to do trauma work to see an outpatient mental health therapist after they got released. And that would be the time for them to start trauma treatment.
Yeah, it's interesting because of I guess the timing. Most people in that scenario, they want it right now. They want it to be done
Yeah,
and over, and
right.
it's frustrating for the other side because, like you said,
Mhm.
it's not a race and it can't be done quickly. And as
Mhm.
much as we want the process to just, like a band-aid, we want to rip it right off. We got to go really slow
Yeah.
to make sure we don't miss anything and all that stuff. That's interesting, and I I could only imagine kind of the redundancy and the day after day and just sort of the repetition that you guys go through dealing with the same things over and over again. But it does have to be
Mhm.
pretty great when you see them after the fact, or you actually see someone, move forward and continue their life in a positive direction with no drugs, no criminal history, and they just sort of, you know, um, take flight, I guess. Is that something that you see frequently, or I guess more times than not the other direction?
You mean seeing changes in patients?
Yeah, like in a positive way before. I mean, I know that we can say that most of them, yeah, it doesn't usually work out, but in terms of people moving forward in a positive way, is that something that happens frequently for you?
I don't think so. I
Okay.
still
Yeah,
see a
yeah,
lot. Yeah, I still see a lot of frequent flyer. I still maintain my positive hope that it will happen, but of course it doesn't go my way all the time. But
sure.
I do have actually one very positive story that I can share. So
Please.
he is a very young gentleman. I don't remember if this is his first time arrest, but very young. And he was arrested for the most serious charges that you can think of, and I've seen him for maybe over like 2 years when he was incarcerated in jail. So at first, when I saw him, he was quiet. He, you can tell he's very depressed. You can tell, but he's not telling you anything. And like he's not talking to me. He's only answering yes, no questions when I ask him certain things. And then I said, "Are you okay? Keep staying, at your current housing, because we have different dorms that he can stay at." And he was like, "Yeah,
Hmm.
I'm fine." And then he never wanting to do anything. Like he never really want to work with me. He just, I mean, he'll come, he'll be cooperative, but he wouldn't want to tell me anything. So one day he said to me like, um, I mean, I want to read a book, and resources is very limited, over there. And I said, oh, okay. I mean, well, thanks for letting me know what you want. I mean, let me go see what I can have. I mean, however, our resources is very limited, so we might not have many options for you to to pick what books you want to read. Can I pick one and then I'll just bring it to you? And he was like, yeah, can you just bring me like a like a fiction book, and I said, okay, I can see what I can get. And then I went to my office because we do have some book donations, and I just picked like a thick book because he has time. I picked the thickest book
Hmm.
that I can find, like maybe this thick, that book. Then I brought it to him. I went to the floor, I gave it to him. I was like, okay, that's the only thing I can find, that's very thick. Because that person, I'll see him once a month. So I said, okay, in a month, let me know if you're done. If you're done, then I'll bring you another one. Okay. I'll switch it out for you. He was like, okay. And then a month later, I see him again. And then, continue to do my thing, check in with him, making sure he's doing okay. Still, I know that he is depressed. And then while I was typing up whatever he was telling me, he told me, um, like doctor, he called me doctor. So do you think that people with like family member who has bipolar or depression will pass it on to their own other family member? Like, let's say, you know, if my grandparent has it, well, I have it. I was like, wow. And I stopped typing completely, pushed my computer on a side. I was like, whoa, you know, well, thank you for asking that question. That's very insightful. What made you ask me that? He was like, well, the book that you gave me, you know, they talk about this girl, and then he started talking about the book. Oh, this character, her parents had schizophrenia, and then it turns out that she had some sort of schizophrenia-like symptoms. So I want to know if that's related. So I was like, oh, wow, okay, that's really cool that, you know, you're talking about it. Okay, let's talk about it. So I gave him some research studies, like information. So I said to him, oh, mainly bipolar, who was like, you know, genetically related. I mean, little studies support that schizophrenia is also genetically related, but not so much as bipolar disorder. So we talk about mental health. And then I didn't even realize how long we sat down and just talked about statistics and then studies results and all that. And then towards the end I said, well, so do you have any concern about your family, like any family member has such concern? And then I think he mentioned about his mom has mental health issue, but he doesn't know what it is. So I was like, oh, okay. So I mean, so what about now? Like, do you feel like it affects you or no? How do you feel about that, knowing all these information? And then he was like, that's very interesting. And then he said, I start believing in mental health now. I was like, wow, with one book that makes you believe in mental health after I check in with you for so many months. And then he was like, yeah, I believe in mental health now. So, and I was like, okay, if you have to use one word to describe how you feel right now, what would you use? He said, I'm sad. That's the first time he told me that he's feeling sad, and I call it depression. So,
Hmm.
of course, then later on, we talked about it and all that. So, long story short, you know, I kept seeing him until he become a trustee in one of the floor, and then he would come out, he works, he cleans. um Finally, eventually I see a smile on his face for once after working with him for 2 years. And then he was like, I'm doing fine. Like every time when I walk by, because you know I moved department, so but when I see him working on the floor, I'll be like, hey, how are you doing? He was like, I'm doing well, I'm doing better, you know, I have court here and there, you know, like he would tell me he's doing good. So I'm proud about the changes, about how he's aware of mental health illness. Sometimes I know that it's not a pill that you take. Oh, I feel better. You know, it's like a cold or anything. I take a pill and I feel better. It's not about that. But to me, it's all about the awareness of mental health symptoms and all that. If you're aware, maybe one day you realize that, oh, okay, I have this. Maybe I need to start doing something to make a change to it.
Yeah, that's a great story. I like that. And it's an interesting analogy because the common cold, right? I can do all these things to make it go away, but mental health, um, if we're battling something internally, more times than not, we're not going to be able to just get rid of it. It's going to require a lot of work and a lot of time. And if people understood how much time it would take to diagnose, to create a plan, and then to actually take action, I think that's why we sort of see, the end of the road being suicide, where people ultimately can't. And, my own personal experiences with that stuff, I would say that suicide is not a means to die. It's a means to stop the pain. And for most people who have been close to it or have been, you know, it's a weird way to say it, fortunate enough to experience that type of mental health, crisis, it really does go to show how just sort of how deep the water is with, the darkness that can take over and all that stuff. But I think, if you do it the right way and you talk to the right people, it's interesting to see your perspective in the jail too. And unfortunately, I think a lot of people don't really care about the people in jail. Oh, well, they're there for a reason. They're this and that. But I don't think that the majority of people understand that if we really want to see a change in society, it starts with stuff just like that. Because if we create a place and a structure and a system that allows for people to truly rehabilitate and exit and become, normal people, I hate that term, but I would just say contributing members to society, then we reduce that criminal element within our cities, our towns, and our neighborhoods. Um, Unfortunately, I don't think the public really has the buy-in because they just assume that they're, not going to change. Um, but there is a different dynamic to me where I feel like the majority of people who really want to change, they're usually creatures of habit. It's usually drugs or some type of substance abuse coupled with crimes that I would say are low level property crimes, where you have, people who steal, people who rob or burglarize. But then
Mhm.
for me personally, there's a pretty hard line in the sand between what I would call bad guys and then evil. And bad guys are again the people who probably had a bad upbringing. They got into drugs, they got into the wrong, group of people, and they started committing crimes. And 9 times out of 10, when they're sober, they feel bad. They feel terrible, and they go, "Yeah, you know what? That was stupid. I should never have done that." But then there's this special group of people for me where it's your rapists, your murderers, people who killed not for gain, but because they liked it. And that's a whole nother arena in terms of psychology when you're dealing with someone whose mental takeaway is not based on gain, but rather the internal gratitude that they get when they kill or when they rape.
Mhm.
When it comes to that population, are those individuals, do you talk to them as well?
Yes. So we do have different terms. So you call them bad guys versus evil. So the bad guys are the ones that like have are remorseful, right, about the drug
Hmm.
use.
Sure.
Usually, maybe they'll get like a drug diagnosis, like substance use, substance abuse, or something. The evil that you mentioned, we have a different diagnosis for them. Very likely, I'm guessing, not all the time, okay, not 100%. They could be antisocial. Antisocial personality disorder is what we call them. So they are not remorseful for what they do. As a kid, they might have like oppositional defiant disorder, like meaning like challenging authorities and all that. If it is more severe level, we call it the conduct disorder. So after 17, if they still have conduct disorder that is not treated, that will be very likely to get diagnosed for antisocial personality disorder. Exactly how you describe them. Committed very serious charges, and then they don't think it's an issue. It's their problem. Something like that. And then they'll continue to challenge authority.
Yeah. I think
And I
there's a, sorry, go ahead.
Oh, I do see them in the treatment room back then. Here, not I mean, in the current triage intake process, not as much. But back then, I saw a lot, and those are very difficult to treat because you have to have them buy in. However, a lot of the times they won't buy in, and
Yeah.
they would just not. They don't see that it's a mental health problem or concern. They are not motivated to make a change. They will continue to do whatever they want. So those are very, very tough to treat. So number one reason I would say for mental health, it's not about the therapist. It could be you, it could be me, it could be somebody else. The therapist doesn't matter. What I think it matter the most is how motivated are the persons willing to change. So if they're motivated, very likely that person will be successful and will change and break up the pattern. But if they're not motivated, it doesn't matter if you have like a very good therapist. It doesn't matter. I would always call it the patient factor versus the therapist factor.
Interesting. Yeah.
Mhm.
It's, yeah, it's real. I also think too that there's just so, uh, I used to pick a serial killer every year, and I would just kind of in that year read books or do research. And the majority of them did share a very consistent theme with child abuse. A lot of them were abused sexually or physically, mostly physically. And it was kind of the same element in terms of what you would see for the quote unquote bad guys. However, the addiction element almost was non-existent. A lot of them didn't really have any type of drug or alcohol abuse. It was pretty much just stone sober. They were finding their release in homicide, so they were finding their gratification, which is interesting because as technology develops, I feel like serial killers are still alive. They're just not as active because they can't be, because the tech boom pretty much killed anyone's ability to murder over and over again. If we look back to the 60s and 70s, it was easy to be a serial killer because you could do it over and over again, and the tech was so delayed. Versus now, it would be very hard to commit murders in mass over and over again. So it's kind of scary because the psychological element is still there. They are still, walking among us as people. But I guess, if they do come to fruition and they ultimately make their desires a reality, are we going to see things very similarly to the case in Moscow, Idaho, where it was the triple homicide that they had up there for that one? Is it going to be more of a one and done thing? I mean, it is strange to think about. Do you think that that's on the table still in terms of the psychology aspect? Do we still have those people that are having the same issues, but they have to figure out a different way to sort of, I guess, make their what would have been, homicidal behavior? Are they going to have to get creative, or, like I said, when's the last time we really saw, a serial killer in the last 10 years? It's very rare.
Well, fortunately, I haven't seen one.
Good.
Fortunately, yes. To be honest with you, serial killers are very interesting cases that I haven't really do any research about them, but I agree with you. A lot of them do have a history of traumas. The I think the one that I'm most familiar with is Richard Ramirez, because the
Hmm.
whole show that was on Netflix and all that, right?
Yeah.
So yeah, that's the only one that I'm familiar with. So yes, definitely history of childhood trauma. Also, I think he has a sense of like when he committed a crime. I think he gives me a vibe that like, oh, it. I feel great for doing this crime. I feel great for committing this crime, which is not typical. Like us, like you and I, like if we did something wrong, we probably will feel, oh, I feel so bad. I feel so remorseful. So, this is something that like completely different that we probably won't be able to understand how their thought process is like. Um, Very likely, I mean, I'm sure he hasn't have a formal diagnosis back then, but very likely he could be one of the example for patients who are experiencing antisocial personality disorder. Like
Yeah.
like doing this make me feel great. I'll continue to do that. There's no reason for me to stop doing this. That's why he committed so many crimes.
Yeah. So for the people who don't know, antisocial personality disorder, what exactly is that?
So it's a personality disorder. How do I explain it? Because it include like a lot of stuff, but let me make it simple. But
Sure.
basically, this individual has no fear of authority, including police officer. A lot of the time, they like to challenge police officers. If that's the case, you will already know what kind of situation they'll commit it, right? And as a kid, of course, the authoritative figure is who? Your parents. And probably starting from childhood, you have no fear of your parents, and then
Hmm.
or parents couldn't do anything to put a foot on this person and be like, hey, you can't do this and all that, and the kids will continue to be defiant and not listening, right? And at school, it's the teacher and principal, right? So this kid probably growing up will continue to challenge their authoritative figures, not following rules at school or at home. And then they might be a bully at school, like taking advantage of other children who are more vulnerable. And as an adult, you can imagine, okay, challenging authoritative figure would be the law enforcement. Bullying about the vulnerable could be us civilians, any one of us, And I'm using Richard Ramirez as an example. So I think he took advantage of, some older adults,
Yeah.
females, kids. I know maybe he murdered like a spouse of one of the victim that he raped. And then yeah, basically he would do the same things. Like he would not follow rule. He'll continue to commit crimes. And then
Yeah.
when you talk to them, at first they will try to use their charm on you to show you that I am a good person. I have no idea why, they arrest me. I did not do anything wrong. There's no reason. But once you get to know them, they'll show you their true color, that,
Yeah.
they actually would have no fears. And then if you do if you try to redirect them, hey, think about this. You need to follow directions and rule. And then they would think that you're not siding with them, and that we become the bad person, even though when we were trying to work with them.
Yeah, and the that's interesting because the average person, if you told them, "Hey, if you murder someone, you're looking at going to jail forever," that would be enough motivation for that person to go, "No, I don't want to do that." But
Yes.
that concept of fear is just not there. They don't even care. It's almost like, "Fine, like I'll go to jail. I
Hmm.
don't care."
Yeah.
And that kind of goes into the defiance thing too, where you have just that attitude. That's really interesting. And it's sort
Hmm.
of it's funny, but it's not that we keep going back to the concept of parenting and
Hmm.
having structure because we have this person, Richard Ramirez, who was, I can't remember how old he was when he was finally arrested, but he wasn't young. He was in his probably 30s at the time.
Hmm.
But
Hmm.
we could rewind 20 years and then just barely scratch the surface of what created Richard Ramirez now or then, um, and the lack of everything. I mean, I think most guys, serial killers or murderers, whatever it is, there's a large amount of abuse that usually takes place, or even just a lack of control, which is interesting because I can think back just on some cases I worked over the years where we have these, pretty substantial cases, and you talk to mom and dad if they're still around, and they'll say things like, "Well, I could never control him. I could never do that." And I didn't understand until I became a father. My oldest is 14, but I figured out pretty quick with the way I was raised that if I don't have some type of control, I mean, I don't understand how parents say I can't control I mean, that's just me. I get it that some kids are challenging, but at the end of the day, if you can't establish a firm grip on the, lifestyle choices of your child, personally, I think that's a parenting issue and one that needs to be fixed. You and I spoke a little bit about you growing up. You grew up in a fairly, I would say, strict household with parents
Yes.
who really, sort of had
Mhm.
their finger to the pulse of your life. And as an adult now, it kind of makes sense. As a kid, you're like, why are you always, just on me all the time? Well, they're keeping tabs on you. They're making sure. And just like I did when I grew up and I entered my 20s, I finally went, well, that makes sense, right? My parents weren't being assholes. They were trying to push me in the right direction to make me be the best possible version of myself. And
Mhm.
it's easy for you and I to talk about it because we lived that life, but there's probably a lot of guys and gals out there who were not lucky enough to have that structure when they were younger. And
Mhm.
now here they are as adults. And it's almost like we're trying to manage the inner child of those people who are in a weird way sort of
Mhm.
craving that guidance, but they still don't have it as adults.
That's right. That actually reminds me of my old job when I was a child psychologist. I do see a lot of children who has oppositional defiant disorder. So oppositional defiant disorder is basically kids who doesn't follow rules. Go to
Hmm.
school, no rules. Go home, there's no rules, and constantly, challenging teachers, and then getting into troubles. Um, getting involved like with situation with their friends at school and all that, right? So I see a lot of them for my work back then. And then back then, I work at a clinic. So while I'm working with the child one on one, trying to redirect them and try to see what's going on that they don't like to follow rules, um, the clinic has somebody called a case manager or a parent partner. So they would be working with their parents, the kids' parents, and trying to like guide them on how to parent the child. And there will be times the four of us, like the kid, the parent, and case manager and me, will sit together in a session. We call it the family session. So we'll talk about, okay, so little kid, you learned this in my session, and now mom or dad is here. So if mom and dad, da, 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 we will talk about stuff. And also the case manager or the parent partner, they'll be like, okay, so remember we talked about this when situation happened, the kid is not following your direction. How do you manage this structure at home so that you don't not let the kid to take over the power. You need to
Hmm.
let him know you are the parents. You have the final say at home. He is not the boss, but you are the boss. So we talked about certain skills, and of course, like different family have different dynamic. We work with each one of them differently, by knowing what's the cause, uh, the family dynamic, also whether like which parent should be involved, mom or dad or both. Mhm.
Yeah. I I grew up my dad wasn't scary, but I was scared of him sometimes in a healthy way. Like he was, he was I don't know, he was my dad was a great guy, very stern but fair. But there was a healthy level of fear that if I screwed around too much that there would be consequence.
Mhm.
And my brother and I were raised that way, and it kind of sounds like you were raised that way too, to where you knew that if you didn't do what was expected, and not that there were unreasonable expectations, but just, hey, this is the way it is in this house. And that control word is just so important, because I feel like some of these parents, and it's not an excuse, but it's real. Like, I don't want to say,
Mhm.
and give everyone an out who has a criminal history, that they're just sort of living a reckless lifestyle. But I will say that that's not something that you see with households that have a fairly strict parental structure. And for me, the portion that the dad introduces, father figures, it's so critical in most households. Where if I looked at my caseload for the last however many years, and I saw some consistent, a lot of them didn't have dads, or if they did, their dads were actually incarcerated or just
Mhm.
non-existent, which was sad, because I'm not discrediting the power of a mom or what the mom provides, but there is something to be said about what a father figure brings, especially to boys in a
Mhm.
household where, that if we were looking at the male prison population, because it's larger in terms of, populace overall, but how many of those guys didn't have that father figure in their life? And it's so funny, because you almost hear it in their voice. They wish they had that, but they never did. And
Mhm.
it's sad, because I feel like the majority of them, even them being fathers themselves, they see themselves being this horrible person, but they're almost okay with it, because they're so resentful and angry at their own fathers, that now it's like, well, I'm just going to keep this cycle going. And like you mentioned earlier, you talked about, them, you want your kids to see you like this. And the answer is no. But yet here they are, still living that lifestyle, and almost like it's for spite in a weird way.
Like a revenge, right? Yeah, like a
Yeah.
revenge. Yeah, so absolutely agree with you. So yes, my dad is strict. But at the same time, I think he also did very good role modeling. So to me, parenting is not just I tell you what to do. It's also model. Like let's say if you tell
Mhm.
me something, but then I see you do another thing, then I'll be like, then why do I need to follow your direction? I will challenge you. And I actually did, when I was little. But not my dad. I went to a babysitter. I remember when I was a little kid. So the babysitter, cause I mean, I'm Chinese. So when we eat, we sit together and then we do family style. So, and then I sit and wait. And then the babysitter was like, okay, well, you have to wait until everybody sit at the table. Then you can start eating. And I was like, okay. So I waited and waited. And the babysitter started picking up her chopsticks and eat some food on the table. And I looked at her. I was like, wait, didn't you ask me to just wait? And then why are you eating? And then I asked her, but you're eating. And I was like probably 4, 5. And then the way she answered me, like, I'm different. I'm an adult. So I was like, that's not a good answer. And then I
Yeah.
remember I went home and then I talked to my mom about it. My mom is very nurturing. She is strict, but not as strict as my dad. My dad is purely strict. And then I have to follow my dad's rule, especially my background. I have to. I just have to listen to my parents. And I talked to my mom, and my mom is always a good guidance. And then sometimes when there's something that I disagree with my dad, like even though he said I have to do certain things, I'll talk to my mom. And my
Hmm.
mom would be like, explain things to me. Like, for example, this little story I told you, she said, well, this is not right. I mean, she shouldn't tell you that, but that's true that you have to wait until everybody sit down and eat. That's being polite and well mannered. And it shows that you're well educated. Like, she'll give me reasons. So I think parenting, one big thing is like, don't just tell your kid what not to do, but tell
Yeah.
them what to do with reason. Like you should do this. The reason behind is XYZ. I think that helps the best.
Yeah, I agree. My dad always told me, I won't tell you what to do, but I'll tell you how to do it. And that didn't make sense to me until I was an adult. I figured that out in my 20s, but that was
Oh,
kind of his way of saying, like, I'll always tell you how to, do things. And yeah, it was interesting, but I agree that there's it's just one of those things where if we just sort of have that mentality of, well, what was the saying, do as I say, not as I do type stuff, well, then eventually we're going to go, no, well, you're just, you're a fraud, you're not really teaching me anything. And yeah, I that was kind of, it threw me for a loop, that just not telling your kids what not to do, because we spend so much time saying don't do these things, but we also don't really spend enough time uh explaining, why.
mm.
Or yeah, that's interesting. And I really wonder
Also,
how much of that resonates with people that you talk to, and if, it sort of puts the pieces together that they would have wanted, 20 years ago or something like that.
I agree with you that they probably don't have a role model or a father or mother figure that they can look at and as a role model. So that's why in parenting I also stress on role modeling. So let me share with you another story. So when I was in grad school, I was working as a behavioral therapist. I basically treat children with diagnosis of autism. So I was a supervisor, and then I would go to the kids' home to do therapy with them. We call it applied behavioral analysis (ABA) therapy, and then at the same time we work with the parents. So we show the parents what we do. So let's say if the session's like successful, the kid is listening to us, so we'll show the parents, okay, this is what we do in session. So at home, if you can be consistent with us, then your kid will make a big improvement. So there's this kid, his room is very messy. It's like more, if you can imagine, like a tornado hit it. So
Huh.
the mattress would be out of his bed on the floor. All his dirty clothes would be on the floor, and then things just would be in a place where it shouldn't belong. And then the mom will complain to me, "Oh my God, like his room is so messy. If you can help him, teach him how to clean his room, that would be great." And also the fact that I don't like it when he lie on his bed, like he would lie on his bed and he would eat. And I said, where did he learn that? And she would tell me like, well, my husband is messy. And I said, oh, okay. So I said, would he eat in bed? And she said, yes, like he would lie in bed and he would eat. So I said, he needs to stop that because
Yeah.
kids are very, very well observation learners. He
Yeah.
sees what his parents do, they will do the same because they think it will be okay. Or if I tell them, hey, it's not okay for you to eat in bed, he would question me. Why would my dad do that and I can't do that? You know? So that would
Yeah.
be a big challenge. I said that from your parents' perspective, you guys have to work on that first. But at the same time, I'll work with your kid on cleaning his room and tell him not to eat in bed. Like I'll try to do that with him. But at the same time, after I leave, because think about it, I'll only stay here for like 1 hour, 2 hours. After I leave, the remaining of the 22 hours during the day, I need you guys to follow through.
Yeah.
So that will be a big issue. And I think, I don't remember I worked with that family for too long, probably half a year or 9 months. But from the time that I was there, I don't recall the kid was doing better in terms of cleaning his room or eating in bed. So it stays the same.
Yeah. Huh.
Mhm.
It is it's weird to think about how our kids are just like sponges. They just absorb everything.
Mhm.
And I
Right.
had to personally, like, it was years ago, but my kids were arguing and they sounded just like me when I would get mad. They were saying the same things or using the same words, and I was like, God, I gotta stop. So I really had to reevaluate how I would get upset. And this is when I was on graveyard, so I had weird scope. My patience was very thin. As I got older and I realized, like, okay, I have one shot at basically making sure that I don't screw up their lives. I have 18 years and change to, but essentially the first 10, maybe in the first 5, to make sure that they have this upbringing that is, I feel like most parents, genuinely, they don't think they're doing a good job, but they are. Like, I always tell my wife, I don't think I'm doing enough. And she's like, no, you're doing great. Like, you're a great dad. You're a great this. And you always kind of feel like you could do more. But my son being 14, oh my God, that flew by. And thankfully he's a good kid. he listens and does what he's told. And I would equate that to parenting, but also just like, our whole family, accountability on all angles, from grandparents, from everybody who's involved. And it is interesting. It's a very interesting dynamic, and the psychology, everything that goes into the psychology aspect of it is just so interesting, because there's so much human element to where we are right now as adults. And you and I sitting here, fairly successful human beings, it's not just happenstance. There was, an introduction to control from a very young age. There was accountability, there was punishment, there was reward, and that's kind of what brought us here today. So I'm thankful for that. And I feel like if most people understood that it's not just black and white when it comes to the criminal justice system, and oh well, they're just, they're bad guys for this, they do drugs for this, there's a nexus to why all of this is happening. There's a nexus to why someone is the way they are. And for people to assume that it's just something that can be fixed overnight, it's not true. But again, going back to what we were talking about before, that if the average person understood that if we put more of a proactive effort into helping these people change, well, then the result is good for society overall. It doesn't benefit just one person, it benefits everybody, um, which is interesting. So I think that's a good place to leave it. But Erica, thank you for what you do. Thank you for your hard work. I don't think that enough emphasis goes into the people who work behind the scenes. The law enforcement portion of this is just a small piece to a very large puzzle. And it's people like you who have to do a very hard job every day. And I don't think enough people understand how mentally taxing it is and how hard it is to do it. But like you said, at the end of the day, if you get that, those positive stories, or that one experience where you see an individual change. Like I always tell people, I love seeing someone outside of work and they recognize me and I have no idea who they are, and they go, oh wow, like you look totally different. Like, oh well, I got sober, I got my kids back. And that doesn't happen very often for me. So when it does, it's huge. And they may say, well, hey, thanks for arresting me. That was, this, as horrible as it was, that was a huge moment for me. So again, for you and all your efforts, I sincerely applaud your work. For people who have questions, or if they want to get in touch with you, I have your social media and I'll tag it in the video, but are there other ways that people can get in touch with you?
Social media would be good. So that would
Okay.
be one of the way. And I responded.
Sweet. And I know that there's a lot of people who are interested in this career field, and I would say that we need a fairly consistent, just as much as we need, cops on the road, we need psychologists, we need therapists, we need all of these things that are the internal portion of what would keep the criminal justice system moving in a positive direction. So, yeah, thank you so much for being here. I really enjoyed having you. And for the audience who is not familiar, again, can you just give I know there's going to be a lot of inquiries as to what exactly you do. So your title again is what?
I'm a supervising psychologist, or
Okay.
clinical psychologist who is currently working in a correctional facility in Los Angeles.
Awesome. Sweet. Well, Erica, Dr. Fung, thank you so much for being here. I appreciate your time. And again, thank you for all that you do. And guys, that'll be the end of the episode. If you want to reach out to Erica, I'll have her information attached to the video on the Spotify and YouTube and Apple link. Erica, thank you again for being here, and thank you for being on the show. Again, I appreciate all that you do.
Thank you for having me. I enjoyed it.
Thank you. All right, guys. See you next week.